Dr. Karataş, Varicocele, Berk Karatas. We will talk about varicocele disease, which is the most important cause of infertility. We will have a few videos related to this. I recommend that you watch all the videos. I will explain all of them briefly. If you watch all these videos, until the end, you will really have a solid understanding. Before we get into the causes of varicocele disease, let me explain why it's important. Varicocele disease only seen in 15% of men. When examining those who are unable to have children, varicocele disease is detected in 40% of them. When looking at those who already have one child and want to have two or more, varicocele disease is detected in 80% of them. So in this sense, it's very important. Another important point is that if varicocele disease is treated, meaning if we undergo surgery for varicocele disease in the first year, the chance of our partner getting pregnant is found to be 40% in the first year and 60% in the second year. That's why varicocele disease is very important. Let's take a look at why it occurs. Now we have three theories regarding why it occurs. One of them, the definition of the main vein that is varicocele disease is as follows. We haven't defined it yet. DEF. The enlargement or dilation of the testicular vein. This usually occurs on the left side. It's seen less frequently, but right side. It can be seen on both sides, but it is most commonly seen on the left side. Why it happened on left side? There is an anatomical explanation for this. So there is also a physiological explanation. That's it. Look, the veins on the right side haven't dilated. Normal, it wraps around the egg and it goes upward, opening into our main vein. The vein on the left side has enlarged here, meaning a varicocele has formed. It doesn't open into our main vein. It travels a long distance and opens into the renal vein. And look, there is an angle here, but here it's almost a 90-degree angle. According to the theory of gravity, when it enters at a 90-degree angle, the return of the blood is easier. A second mechanism, for example, there is a valve mechanism in the veins of the legs. So, there are valves to prevent the blood from flowing back down when it goes upward. It's closing, it pushes the blood upward. If the blood wants to flow back, it closes. In the veins of the left testicle and the right testicle, these valve mechanisms are either absent or very weak. That's why it's very normal for the blood to pull back like this and for the blood vessel to increase here. What does the physical condition matter? Especially in tall individuals. This vein is longer, varicocele often in tall, thin. Since it travels longer and enters more vertically, varicocele disease is more frequently detected in tall and especially thin individuals. Is relation to occupation? Yes, especially in people who stand for a very long time. It can be seen, for example, we can count teachers, soldiers, police officers, and guards among many others. Also, in athletes, because the blood pressure inside is very high and their muscles are very strong, it becomes harder for the blood to return and go upward. It's easier for it to return. For this reason, the profession is quite important for us. Yes, we explained its importance this way. We explained why it occurred. We will continue in our next video. Thank you.